Correct?
That's right.
Good. Thank you. Dr. Francis, we're prepared for your testimony.
Thank you, Mr. Chairman. Thank you for inviting me, members of the committee. I have given written testimony, and I will just paraphrase that testimony.
Your entire
right
testimony, each of you, will be printed in the record in its entirety.
Thank you very much, Mr. Chairman. I have recently retired from over 20 years work with the Centers for Disease Control, having worked in a variety of capacities in about 6 different countries with multiple different diseases, all the way from laboratory assignments in Atlanta to bush assignments in Africa. I think CDC is a great and essential institution for national health and for world health and should be supported to the utmost.
Dr. Francis, pull the microphone just a little closer.
Even closer. It's, unfortunately, I've seen a remarkable decline, at least in the second half of my career over the last 10 years, in its ability to save lives and interrupt the transmission of infectious disease, especially AIDS. There's been a tremendous vacuum of leadership given at the upper levels of executive department in this country. And into that vacuum has moved extremism, which has indeed prevented several terribly important things to happen from the Centers for Disease Control to aid the public health of this country. One is logical science, setting up logical and science-based policy, total obstruction to that. 2, moving reasonable funding down to follow through with that policy to field prevention programs for HIV. And last, obstruction at the programmatic level of the essential tools necessary to prevent HIV infection. As you pointed out, Mr. Chairman, early in this meeting, that this is not new. The National Academy of Sciences in 1985-86 described the U.S. government's response to AIDS as woefully inadequate, and just last week, the National Commission calls it tragically insufficient. Let me, as someone who's worked with dangerous infectious disease around the world, try to put HIV-1 in perspective, asking 3 questions. 1, is HIV-1 dangerous and worthy of a government response? HIV-1 is the most dangerous human virus that we know. There is no other agent that kills 75% plus of the individuals that it infects. There is just no such thing as a human virus in that major league category. Not only is it dangerous individually, but it shows remarkable ability to invade populations. If we talk about the 750,000 individuals in the United States, at least who are going to die of HIV from infections that exist today, you're talking about more mortality than the cumulative mortality of all American war dead since and including the Civil War until now. In addition, you're talking essentially now of 1 Vietnam conflict every year in mortality from HIV. A huge public health problem worthy of considerable government intervention. Question number 2, has our response to HIV from a public health standpoint paralleled what we've had for other infectious disease importations into the United States? Clearly not. What we have done, if we get a single importation of smallpox in the days past when that existed, if we get some exotic virus like Lassa virus from Africa, if we get plague importations in this country, we make major efforts to even combat one individual infected with these agents. And yet, with 1 million individuals in the United States, we clearly are at a business as usual policy. Question 3, has CDC been able, CDC has a remarkable history of gathering data, making appropriate responses to the information that they have gathered, fielding those programs and evaluating those programs. Has, in the HIV sense, has CDC been able to field science-based programs? How can CDC field science-based programs and prevent HIV infection when upper levels of government take a whole year in deciding what can be said to gay men regarding HIV infection in the United States? How can CDC promote public health when the promotion of condoms, a very effective therapy, a very effective preventive agent for our tool for HIV infection, is essentially stifled because we can't use the C word? How can CDC prevent intravenous drug use infection when there's tremendous resistance to not only fielding needle exchange programs in a comprehensive drug treatment and prevention setting, but actually prevent their evaluation. And the examples go on and on. CDC has essentially been forced to follow political dogma instead of the pursuit of public health in the United States, a terrible scar both for the HIV epidemic, but I think equally important for an organization that's absolutely essential for the public health of the United States. Now, Dr. William Roper will be forced to defend an indefensible position, which I think is a shame. What needs to be done? First of all, I wouldn't force Dr. Roper to force indefensible positions. I think CDC needs to be helped towards its pursuit of excellence and flexibility and the pursuit of the public's health, and not go back over and over the well-documented interference at upper levels in the executive department have done to CDC. In that regard, I think there's three essential general themes that need to be dealt with. One is policy, two is resources, and three are structural issues. Regarding policy at the national level, if we are going to have public health in this country, you people here have got to figure out some way where the scientists at CDC can speak the truth and deliver programs. If there's not a structure that protects the Centers for Disease Control from political extremism, this country is doomed to continue to suffer from infectious diseases. A structure needs to be established that will actually isolate the public health decisions in this country from political extremism. Second, in a policy frame, we've got to start setting some national policies that make some sense regarding intravenous drug use and drug addicts. We cannot have this schizophrenia regarding drug use and addicts and push them away as them compared to taking them in as us. As long as we continue to do that, we'll continue to infect our inner city populations. Resources. We've got to commit resources that are commensurate with prevention of HIV infection. If we've got a disease that's causing essentially 1 Vietnam War mortality per year, we should be putting resources in to do that. We certainly can prevent HIV infection. Why aren't we putting the resources to do it? So policy, research, resources, and last, the structural issues dealing with programs that I see as a major priority. First, schools. We cannot have wishy-washy, half-baked, pure educational program for our youth. I have 2 kids in school, and I really want them to have very aggressive AIDS education in school. They've got to deal with condoms, they've got to deal with sex, and they've got to deal with needle injections. We can't have these continued obstruction of logical policy in schools. Second, the Centers for Disease Control and the medical institutions in the United States should begin the policy of routine voluntary testing of everyone. And I will put everyone in quotes because there's some that are just clearly not at risk and do not justify the expense of that. That testing of HIV should become the standard practice in a routine voluntary way in all contacts with the medical system. Last, that lifelong medical and behavioral follow-up of those individuals identified by this testing program to be HIV infected should be standard practice and should be paid for by the government. Why? Because the HIV-infected person is the source of infection for the next generation of cases. We've got to welcome HIV-infected people into long-term medical care so that we can advise them and their contacts how not to infect other people. Right now, we test them and then ask them to go find their own medical resources, and half of those people have no resources. So we must provide what we call early intervention, the delivery of medical and behavioral counseling to them. Finally, HIV is preventable. I think we can prevent probably 80% of our infections that are occurring right now. It's doable. The Centers for Disease Control, in collaboration with state and local health departments and local community-based organizations, can deliver a program. The question is, will the government of this country allow them to do that? Thank you.
Thank you very much, Dr. Francis. We're going to adhere to the 5-minute rule. The House is in session. We don't know what kind of interruptions we will get for action on the floor. Let me start by saying to you, Dr. Francis, that I'm really stunned by your testimony. I assume that, having spent many years at CDC, you would agree that CDC's mission is a life or death one. What I hear you saying today is that CDC is failing in its mission and that people are dying because of it. Am I correct?
You are correct. I think CDC is being forced to failure. I think the country as a whole, if you put it, government institution is responding to the country, is essentially tying it from doing its job, and as a result, people are dying unnecessarily. If HIV were not preventable, and I wouldn't say that, if there's some diseases clearly that you can't do anything about, our knowledge level is not there yet. With HIV, our knowledge level is there. We don't have a vaccine yet, but we have very effective prevention modalities, and we are not delivering them. We are actually volunteering and desiring, it seems, not to deliver them, and acting very childish when it comes to very adult issues. And as a result, many Americans die.
Well, I must say that between the two of you, you have given us a great deal to chew on. In many ways, what you've said is both appalling and encouraging. Appalling that we're not willing to treat this great massacre creator in the same way that we've dealt with other public health concerns. And encouraging because apparently the public has a better understanding than the administration thinks of this issue. And the people, Mr. Oprah, from what you tell me, the people who really are opposed to an education prevention program are such a small percentage that there is not even any political gain for the administration for the path that they're pursuing. So it is really being held captive by a small group of fanatics, know-nothings, who are flying in the face of, what, 98% of the American people, as I heard your testimony, and maybe you can expand on the updated version of the study that you commissioned.
Yes, I can. The only thing I would take slight exception to what Dr. Francis said at the end of his statement about the American, I forget just how he phrased it, America preventing the CDC from doing this. It's not the American public that's preventing it. They want it. On the update, we repeated some of the questions that we had asked in the survey a year ago to see if they were still valid. One was the question about, that I led off with, whether each of a number of things were major problems, something of a problem or not a problem. I said that AIDS was second only to heroin and cocaine use. The new study shows it is first. It is ahead of heroin and cocaine use, both because the percentage saying AIDS is a major problem has gone up, and because the percentage saying heroin and cocaine use is a major problem has gone down. We had a question in the original study about whether each of a number of diseases deserved, should be one of our highest priorities, or a medium priority, or a low priority. That earlier study showed that AIDS had the largest percentage, saying it should be one of our highest priorities. It still has the largest percentage, but it is down a little from what it was a year ago. However, it is ahead of cancer, heart disease, alcoholism, and diabetes in terms of the percentage saying it should have our highest priority. We asked people a year ago how much they felt they knew about AIDS overall. Exactly the same percentage this year say they know a great deal. The percentage who say a fair amount is down slightly. The percentage who say only a little is almost identical. The percentage who say practically nothing, interestingly, is up, which I can only interpret as up from 5 to 8. It's not a big deal. I can only interpret that as meaning the more they learn about it, the more they realize how little they know about it. We repeated the question about how concerned are you personally about getting AIDS. The percentage who are very concerned is up from 27 to 29. The somewhat concerned is off a point from 21 to 20. Repeated the question of the agree-disagree statement about the federal government is doing all it should be doing to educate the public about AIDS. The percentage who disagreed that the federal government is doing all it should has risen 10 points in the last year, from 53 to 63%. We asked a new item this year, the agree-disagree. The federal government should mount a massive scientific effort to find a cure and a vaccine for AIDS. 88% agreed with that statement. We had a question that, an agree-disagree that said AIDS is something that only homosexuals and IV drug users have to worry about. I reported in my earlier statement that 94% disagreed with that. It's down slightly, but it's 92% who disagree with it. So the study shows that as I said in my statement, the old study may be a year old, but it's not a year out of date.
Thank you very much, Mr. Roper. Dr. Francis. Mr. Payne?
Thank you, Mr. Chairman. Dr. Francis, you were indicating the question about the will at CDC in dealing with this issue. As you've indicated, the number of deaths, taking in all the wars in our history, but even if you take the recent Persian Gulf conflict, my city will lose more people to AIDS this year than we lost in the entire Persian Gulf conflict, which at its height, this nation paid $1 billion a day at the height. I might just ask you, why do you think, or in your opinion, that CDC and NIH and the administrative leaderships have, over the past decade, put the whole question of AIDS prevention, research and development, prevention, put it at such a low priority? You know, it wasn't until '82, 4 years after the first reported case of AIDS, the death in '88 occurred, was '82 or '83 before the first dollar was appropriated, and that was only several $100,000 to deal with AIDS. Could you, in your opinion, tell me, because I'm baffled, why do you think that the nation, the leadership in the administration in the past 10 years and CDC have this as such a low priority?
In answering that, I have to agree with Mr. Roper in terms of my misstatement about the American public. I don't think the American public quite knew what they were getting into when they elected initially Ronald Reagan and then carried on with President Bush regarding AIDS. This group was clearly elected on an anti-government stance, and we at CDC were caught in that in a big way. I was heading up the laboratory effort to find the cause of AIDS at that time, and clearly suffered during the years that you spoke of having literally zero resources and less than zero resources. I think they were embarrassed. I think they lost all concept of the government responsibility in a public health crisis. Totally lost it. There will not be a government. We were essentially told that they will look pretty and do as little as you can. That was the line that was told to me when I designed the first prevention program in 1984 for the Centers for Disease Control. That they couldn't deal with it personally. They were embarrassed by the fact that there were gay men and there was anal sex and there was sex and vaginal sex and injecting drugs. They couldn't deal with it at all. And as the leadership pulled away from dealing with it, in came the extremists that were sitting in the wings. And as a result, those extremists have really dominated, not only in the executive branch, there are problems in the legislative branch with extremism on this disease. And even though the American public, and we found, in my experience in California, I think we found that the public is really very concerned about this and will accept very practical, medical, embarrassing education programs. But the government at upper level couldn't, and as long as the government at upper level can't, the local level has a very hard time because they have to reinvent the wheel over and over again. And last is a problem with this disease of the long incubation period. If we had 1 million dead people in the United States in 2 weeks from this disease, we would respond. And yet the disease has a 10-year incubation period, so we have a slow evolving epidemic. And I think one of the real challenges for modern mankind is dealing with these slow incubation period phenomena. Our forefathers were smart, our forefathers and foremothers were smart and allowed us to live through short incubation period phenomena. We learned how to deal with epidemics that have short incubation period. We have a very hard time with ones that come on slowly. But from an infectious disease public health side, it is better, although tough on individuals to die quickly of an infectious disease. If they live for 10 years and are infectious during that whole period of time, it is a greater public health threat than one that has a short incubation period. Because there's the number of infected individuals is far greater, and so the chance of transmission is greater. So these longer incubation period, chronic infectious states are extremely dangerous from a public health standpoint. So 3 things. They lost total concept of government responsibility. They're embarrassed by the epidemic, and the extremists came in. And 3 is an inherent situation with this disease with a 10-year incubation period.
Mr. Payne, your time has expired.
Thank you.
We'll get you on the next round. Mr. Laurel.
Thank you. Mr. Roper, let me just ask a couple of questions. To what do you attribute the improvement of public understanding and attitudes about AIDS? Is it the public education, as meager as that may be at the moment, that has caused the greater awareness and attitudes, in your view?
I think it has to be, but in saying that, I mean education in its broadest sense, what people have seen on television, what they've picked up in popular media, as well as in official education.
When did you, in your second study or in the first study, did you do focus group work on in any focus group work where there was the description of the materials, any description of materials to the respondents,
No,
or the ads, or what they might be like in terms of explicit kinds of materials? That,
No, we didn't.
Okay. Is it your sense? Is it your sense that the public is there a willingness to be accepting of more explicit kinds of material?
Yes, we
in that?
specifically asked about that at both
both?
with respect to children and with respect to adults, and
With
we
adults.
got 80% favoring strongly explicit data.
Do we have a copy of your the questionnaire or the questions?
The full statement that I sent down in advance has the questionnaire, the original questionnaire, not the new one. The new one hasn't really been released yet.
If it has such descriptions, I think it would be interesting to the committee to know what what you were talking to respondents about, and how that
it is
can
a
inform
part
the
of my
committee here.
statement.
Okay, fine, thank you.
We'll have that inserted into the record, too.
Okay, thank you. Thank you, Mr. Roper. Dr. Francis, I too was really stunned by your testimony. Quite honestly, very encouraged by your courage and willing to speak out and talk about the politics of this issue in a way that I haven't heard in the past, and really how people are dying because of political ideology. And it struck me that we have something of a pattern. Last week in this body, we passed in the House the reauthorization of the National Institutes of Health bill, and it was vetoed. And we couldn't override the veto. But there again, with research money for ovarian cancer, breast cancer, AIDS, and I'm a survivor of ovarian cancer, so it's an issue that's particularly important to me. Work with the fetal tissue for Parkinson's, for diabetes, etc. Again, vetoed, and we're looking at a narrow band, to quote the chairman, of fanatics and political ideology, which is, this is not causing difficulty, this is life and death. And it's what we're engaged in here, it's seemingly, and from what your testimony indicates, is that we're really playing politics with people's lives. And that, when I think about it, and I made the connection here this morning in terms of the NIH, and there are other issues that we have voted on in this body that smack of that same kind of political ideology, overriding a number of these issues. It is frightening as hell to me that that's going on. And I think that we need to focus on that in a more broad sense. This morning's testimony leads us in the direction of AIDS and what has to be done with CDC, but in other parts of particularly the health area that we are looking at is that what it means to the lives of people in this country. So I thank you for that. Let me ask you why you left CDC.
It's a complicated answer. I had completed my 20 years and was able to retire from the Centers for Disease Control, and there were some personal reasons for me to remain in California versus going back to Atlanta. But some of it was the excitement and fun and excellence that CDC had in the past is no longer there. Mm-hmm. And yet it's there ready to be hatched. And yet this cap of extremism is put on it, and it makes you spend your time responding to the Bill Dannemeyers and Jesse Helms and Ronald Reagans and George Bush extremists instead of dealing with public health. It consumes a huge expense, a huge amount of time, and detracts from what is enjoyable for most of us in public health, is to be able to get programs down there and make them the best possible.
Mm-hmm. You also mentioned in your testimony in terms of addressing the issue, and I don't know if you can be more. I'm sorry, thank you.
We'll get you back on the second round. Let me just say that one of the things that this subcommittee has done over the years, and this is almost an anniversary date for us. On August 1st of 1983, this subcommittee held the first comprehensive congressional hearing on the AIDS crisis and the federal response. August 1st and 2nd, 1983. And we have had, I guess this may be the 24th or 25th hearing on AIDS or some aspect of AIDS over the years. And what we've tried to do in all of those sessions is to encourage the career people, the scientific people within CDC, within NIH, within the various component agencies, to really be honest about what they see the problems to be and what they see the needs, the financial needs to be, to deal even modestly, honestly, with the problem. I know, and I've publicly acknowledged, that the people who care most, obviously, are those scientists, people like yourself, Dr. Francis, who've devoted a career, lifetime career, to public health. And I've urged people in your position when they were there to, when they come before us, to tell us what the true numbers were that they had asked for. And I recall one dramatic session, and I won't go over by name and specific testimony, but one dramatic session when, under oath, we were able to get out for the first time what the scientists in the agencies said was needed as compared to what the official figures that finally reached Congress were, which were significantly lower. And it has always been my sense that there are some things which professionals should not be asked to stand up for. And I know that it's always a hard decision, because if I leave, the people who are going to take my place are going to be worse than I am, and they won't have the same sensitivity and sensibility. The other side of it is that if you don't tell the truth, and you don't really confront the issues, then the awful policies that upset you continue. And I'm grateful to you for your candor in the testimony that you've given us. We've tried to encourage the scientists, the career people in all the agencies to come forward and to, by leveling with us, leveling with the American people. And if that doesn't happen to suit the political agenda of 1% or 5% of American adulthood, but does suit the requirements of all of America, then that's the way it ought to go. And, you know, I mentioned Mr. Natcher before. He chairs the appropriations subcommittee that has jurisdiction. For years and years, he would approve, and then the House he would recommend, and the House would adopt an appropriation measure much greater than that which the administration requested. The administration would come in requesting half of what the Congress had appropriated the year before. And Mr. Natcher would say, after listening to the testimony, that can't be, and would increase the appropriation to a closer level of what the scientists in the agency wanted. So there is I think there has been far more of a positive response within Congress than one would have had reason to expect, given all the noise, the sound and fury that this small element in our society has been making. And that's really by way of a 5-minute lecture to the scientists and the career people, I guess, to play it straight. That it really is the best news that all of America can get. I thank you for being a listening board for that. Mr. Payne?
Thank you. I thought that was just for the members, not the chairman. But, let me ask Mr. Roper, based on results that you've given us, you have said that individuals are prone to be more receptive to AIDS information now than they were a few years ago. Do you have any personal recommendations for information dissemination so far as the preventative part would be? I mean, if you had your way, what would be some of the methods you would use to disseminate information regarding prevention?
First of all, I didn't say that people were more receptive now than a few years ago. We've only done 2 studies, a year ago and this year, and they both show the same thing.
No,
they
but
show
I mean
higher receptivity.
Okay, but prior to probably 5 years ago,
I would guess
10
that
years
would be
ago.
true, but
Right.
I don't know that. I'm not sure what methods I would use. I would be inclined to leave it to the medical people who know the best approaches, and to educators who presumably know the best way of reaching particularly the school-age children. I don't have specific ideas. It seems to me that the safe sex route is a much more practical route than the abstinence route. But how to tell the safe sex story, who to tell it to, should go way down in age, certainly. But what's the best media, the best methods for telling it, I wouldn't presume to say.
Francis?
I agree with what Mr. Roper said about the change in the American public. Probably the silliest debate that's gone on with AIDS is this abstinence condom issue. For us in public health, it has been absolutely crazy. Abstinence is perfectly fine. Condoms are very effective. If you're going to have sex, and everyone is going to have sex, use condoms. If you don't want to have sex, that's fine, and you should be able to get peer support for that. But the problem was, when the Surgeon General, with considerable courage, came out with his early report, it was the lack of leadership at the upper level of the executive department that allowed, at that time, the Secretary of Education to come in and say it's only abstinence, coming into the bailiwick of public health, ignoring, without without any background, without any knowledge, without any experience, without any wisdom on this subject, suddenly comes out as a proponent that it should be abstinence instead of condoms. And we in public health never said that it was either or. It was a matter of both. So it was this vacuum, and the president never stood up and said, stop this kind of nonsense. The public health people say they should do this, and this is what's going to be put out there. I think the American public would accept it fine. But by leaving this vacuum there, then your 3% extremism came in and got control and disrupted the programs from that time onwards. And that's what, 7 years ago.
Let me just ask another quick question. You talk about the question of abstinence and preventive methods, and I recall when Magic Johnson first made his initial announcement, he did not talk about abstinence originally, he just talked about prevention, and then of course modified it to also saying abstinence is fine too. But let me just ask you about Magic Johnson phenomena with him now playing in the Olympics and having done so well at the All-Star game. Do you think that perhaps young urban youngsters who may not believe that the disease is for them or it's as devastating as it is, what kind of impression do you think might be derived from Magic still looking healthy, playing the best in the world, and just proceeding on? Like, do you think it's like perhaps it's not as bad as they say it is? Or look at Magic. I wonder what your opinion is.
Again, I have a great deal of respect for the American public and understanding what's going to happen to Magic. Enough of us have been around watching our friends who look very healthy one year die the next. I think the message is a very important one, that healthy people have this virus, and you can't tell by looking at someone if they're infectious, and so you better assume that all of your sexual partners are infectious before you have sex with them. So I think that message is a very good one. I think the American public will suffer because the odds are, I hope Magic Johnson is someone who survives forever, but the odds are that this virus will slowly, inevitably destroy his immune system, and the American public will watch that.
Thank you.
Thank you, Mr. Payne. Your time has expired. Mr. Laura?
Thank you, Mr. Chairman. Dr. Francis, was there, when you were there, and do you believe there is now at the CDC some sort of is there continue to be an internal debate on what ought to be done, or is that debate ended?
No, the debate.
Is there any internal consternation about what's occurring in this area that we ought to know about?
Yes, there's tremendous consternation. There's tremendous frustration from people that the chairman just mentioned, people who really want to do something and yet spend all their time chasing endless pursuits of extremism. I think CDC has a tremendous spirit, has a tremendous vitality that what's the responsibility of this country is to allow some system where that can be expressed.
Let me ask as a follow-up to that, because you did say in your testimony that Congress and the President should establish some sort of a command system in terms, I guess, to stimulate and foster innovation. Do you have any sense of what kind of a structure that ought to be?
I think the only parallel that I would make is something like the Federal Reserve, where there is appointments made and independence given, and they still get battered politically, and I think that's perfectly appropriate. And I think great communication between the legislative and executive department should exist so that you can understand the issues, but there should be independence so that the chairman just mentioned the truth. It has been really terrifying working for these administrations. This is not softball games they play. And when the director of CDC sits up here, he's got a shotgun sitting next to him. And there is active interruption of communication between executive and legislative functions of the government, which in scientific issues puts you folks in the dark regarding how you need to deal with something. You can't deal with ignorance. And our technology is moving so fast, and yet our system to be able to apply that technology is almost non-existent when you have an executive branch saying, do not talk to legislators, do not talk to press. Especially in the early years, this was extremely repressive government. Don't kid yourself on this. I mean, I've worked for lots of governments around the world. This one was some of the most repressive I've ever been involved in what we as scientists could say to the public. I mean, at the same time, when you were having your initial meeting, I was writing memos that we were caught between a rock and a hard place of a huge epidemic and no resources, and the Secretary of HHS was saying, I've just checked with all the Public Health Service folks, and everything that needs to be done is being done. That was a direct lie to the American public, and then the folks at CDC are caught in the middle of that when you ask what is the truth. And under oath, you've got someone sitting behind you where you've got to hedge and mumble a lot. And it's only behind the scenes does the truth come out. That's not good for the American public when you've got such an epidemic like this.
Mr. Chairman, we've got a job on our hands here. You've uncovered
Indeed.
a Pandora's box here this morning, I think, Mr. Chairman.
Well, we're grateful to both of our witnesses, both Dr. Francis and Mr. Roper, and of course the GMHC for underwriting and commissioning that report. And hopefully, again, we further the process of education and perhaps even the issue of prevention, and maybe ultimately we'll have some positive responses from the administration. Yes. So we thank you very much. It is possible, Mr. Roper, that we will be submitting additional written questions to you, although we have your materials and those will be entered in their entirety in the record. Is that all right?
Fine.
Good. Thank you so much, Dr. Francis, again. Thank you so much.
Thank you for inviting us.
Our next panel is comprised of Dr. William L. Roper, Director of the Centers for Disease Control, and he will be accompanied, I understand, by Frederick Kroger, Director of the National AIDS Information Education Program, Centers for Disease Control. And before you sit down, gentlemen, would you raise